Anisotropy, heel toe maneuver or fanning technique. How are they related? So first question is what is anisotropy? In simple terms, if a hyperechoic structure is perceived as hypoechoic, means a bright structure is perceived as a dark structure, not because that there is any pathology in the structure, but only because of the positioning of the ultrasound probe over the skin. So then we will say that it is an artifact named as anisotropy. Let us understand the concept a bit better. Say this is a structure below our skin, so we cannot directly see this structure, and you can see, so let us take it as an ultrasound probe. This part is the footprint of the probe. So let us think that a linear probe is placed over the skin and the structure is just parallel to the probe. So in this scenario, we will see this structure as a clear white line or clear hyperechoic line on the screen. But if this structure is not parallel and the shape of the structure is like this under the skin, then only the central part will be reflected to the transducer. When the central part we will see over the screen as a straight line, straight hyperechoic line. But what about the structure of this right side or left side? These areas, when the ultrasound beam will be reflected from there, it will not reach the receiver. So this side and this side will be shown as hypoechoic, whereas all the length of the structure is similar, and it is not, there is no pathology at this side or this side, so that it should show hypoechoic in comparison to this central part. So to see this part also hyperechoic, we have to do one maneuver. So this we will see the structure part by part. So we will do like this, so over the skin. So we will see in this structure as hyperechoic again. So while seeing this structure hyperechoic, of course this structure will become, the central part will become hypoechoic. Then again we will see this side, this another side, which will again become hyperechoic. So to see the whole structure, which is a rounded structure, we have to take help of this heel toe maneuver. So this is a heel toe maneuver to combat the anisotropy artifact in this situation. Okay, there is a possibility of another scenario in anisotropy. Here again this structure is like this, and I am putting the probe or footprint of the probe over the skin over this structure. But now this structure is not bent in this way, this structure is bent in this way. So at this position what can happen? So either this central part will become again hyperechoic, but this side or this side will become hypoechoic. So to combat this one, now what we will do, either first we will see the central part, then for each side I am putting the probe like this, once like this and another time like this. So this movement is called fanning technique. By this fanning technique, again we will be seeing the whole breadth of this structure. So let us see the long head of biceps tendon in a short axis. So here we can see the long head of biceps tendon, and it is a hypoechoic structure. But this hypoechoic appearance is due to anisotropy. So make it hyperechoic, I can take help of the fanning technique. So here when I do the fanning technique, this hypoechoic structure becomes hyperechoic, and then again it becomes hypoechoic. But then with fanning technique, I can make it hyperechoic. So this is an example of anisotropy. So let us see another example of anisotropy. So here it is the lesser tuberosity, and we can see the insertion of subscapularis. So here the right part of the tendinous insertion of subscapularis is hyperechoic, but left side of the tendinous insertion of the subscapularis is hypoechoic. And this hypoechoic appearance is also due to the anisotropy. So here I will take help of heel toe maneuver. So this is a heel toe maneuver and which can show the part which was earlier hypoechoic has now become hyperechoic. But then earlier with the struck area was hyperechoic, the right sided part, it has now become hypoechoic. So again, I can make that part again hyperechoic with the heel toe maneuver. So this is an example of heel toe maneuver, which is to get rid of the anisotropy artifact effect and to evaluate the structure in a right way. Join Asian Pain Academy, learn musculoskeletal ultrasound in depth, and be more confident while doing the pain procedures.